Services meeting to order. Madam Clerk, roll call, please.
Commissioner Marecki. Commissioner Dobb has requested an excuse. Commissioner Anderson.
Present.
Commissioner Colleen.
Here.
Chair Baker McCormick.
Here.
You have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
I have none. Next item.
C, approval of the September 8th, 2022 meeting minutes.
Move approval, Madam Chair.
Been moved and supported. All those in favor?
Aye.
Any opposed? Motion passed. Next item.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, requesting commission approval of a 1-year grant agreement with the Michigan Department of Health and Human Services.
Are there any questions from commissioners on this item? Any discussion? All right, I will entertain a motion. Yes. Them together. Let's see.
We've approved these before, but an account got left out. So that's the reason they're back before us again. I'll move their approval.
Items 1 through 4. All right. Is there support? Support? Okay. It's been moved and supported. Any discussion on item number 1? Right, no questions. Mr. Vice Chair, did you have? Colleen, Commissioner Colleen, did you have your mic on? Did you?
No,
Oh,
I'm
okay, I
sorry.
just wanted to make sure. Yes,
See that these are mistakes on accounts.
right, and that's what we were just discussing.
okay.
Yeah, they're not, so we'll take them individually, okay? But we'll vote on them, yes, individually, okay?
Madam Chair, then I
Okay.
have a question on that. According to
Sure.
the Paperwork, an account was left off.
So can we have our council?
Subsequent to its approval, it was discovered that an account number was left out. And so that's why this is.
Okay, our clerk will respond.
Yeah, we did those last time.
Okay,
Yes, it was pointed out that I can't read.
all right. So we'll move to item number 2.
Item 2, requesting commission approval of Amendment 3 to a 5-year sole source contract with a 1-year option to renew with Global Vision Technologies.
Are there any questions on this item? Yes.
Are we on 2? We're at item 2, the American Rescue Plan Fund, right?
Item 2 is the 5 years for the Global Vision, right?
So what?
Do we have 2 different?
No.
Nope, I
no,
have the
no,
same agenda.
No, no. Hold on a minute.
Okay.
I mean, go ahead, but
Do you see the item we're referring to?
yes.
Okay. Is there a question about it?
What, Madam Chair, can we go back to item 1?
Okay.
My stuff's all
Okay,
messed
no
up on the
problem.
computer.
So
Okay, I'm
before
just-
we move on, let's go over item number 1. And this is a funding special project for emerging threats. That's the item, right? Okay.
Yeah, I just had a couple questions on this. This is over $8 million.
8 million, yes. Mhm. So can someone talk to this item, please? Thank you.
So thanks. It's all broken down into what we can spend money on. So we actually received over 4 million in immunization efforts last year. And it looks like we're receiving the same amount again this year. Are we really going to use that? And if we don't use it, we send it back, right? You can put your,
Or-
just press it. Yep, there you go.
Okay, hello? Yeah. Chair Baker McCormick, this is Dr. Sheth from the Public Health Division, Division Director and Medical Health Officer. And you're correct, this is the same funding program from this current fiscal year, COVID immunizations, that is continuing in the next fiscal year, and we were awarded the same amount. And it's to support our COVID-19 vaccination efforts throughout Wayne County. And so typically, yes, if we do not fully spend the funds, we do return them back to the state. We're hoping to maximize and optimize our efforts in this space. As you all are aware of, we just rolled out our bivalent Omicron booster, and we have our vaccination sites, and every week going out into the community, the schools, congregate care facilities, and vaccinating and boosting and spreading the message out. And so those efforts will continue.
Okay, so they're talking about a new booster now, like a flu shot booster with the COVID. I don't know how, like when we're getting that. I don't know. They just announced it on the radio, so I don't know what happens with that, but is that included in this?
So the most recent booster that was rolled out, it's called the bivalent or Omicron booster. It's the first COVID-19 vaccine that includes the components of the BA.5 and 4 variant that are currently circulating and kind of causing the uptick in cases we've seen in the last couple months. So it's our first new updated vaccine that we've had since this pandemic has started. And we're hoping that this booster will offer better protection going into the fall, where we've seen an uptick in cases in the fall and winter every year. The way that it is getting framed is that eventually COVID-19 vaccination, we hope, will become like the flu shot every fall, right? Early winter, that we push out and we try to get as many folks to uptake on that. I'm not sure if we're there at this moment, but because we're rolling out this Omicron specific booster at the same time that we want people to come out for their flu shot, we're kind of spreading the message at the same time. You know, when you're going to get your annual flu shot, go and get this updated booster. It's recommended for everyone 2 months after they've completed either their primary series or their last booster shot. So if it's been 2 months, and you're 12 years and older, we're recommending you go and get that booster.
Do we give flu shots out?
So through Wayne County?
Yeah.
We do get we get a small supply of private flu vaccine to give out, that we are trying to do some Wayne County kind of employee type of events. And otherwise, our vaccines are mainly geared towards our our Vaccines for Children's program, where they're Medicaid or uninsured and that population.
All right, so it looks like though it's going to be purely on vaccination efforts, this money, the 4 million.
Yes.
Okay,
Mhm.
and you do know that the president said this is all over, so the 4 million might be a little high number there. All right, thank you. Thanks, Madam Chair.
Thank you. Commissioner Colleen, did you have? Nope, okay. All right. All right, so we'll entertain a motion for this item. Their motion, we'll take them one at a time. Since there was
I'll
so
rescind
back
my
and forth.
previous motion since I couldn't read.
That- Okay,
And I'll move approval of item number 1
all
here.
right, thank you. It's been moved and supported. All those in favor?
Aye.
Any opposed? Motion passed. Next item.
Item 2, requesting commission approval of Amendment 3 to a 5-year sole source contract with a 1-year option to renew with Global Vision Technologies.
All right, are there any questions about this contract or discussion from commissioners? All right, is there a motion?
I'll move approval.
Support.
Been moved and supported. All those in favor? Any opposed? Any abstentions? Right. Motion passed. Next item.
Item 3, requesting commission approval of a subrecipient contract with the Detroit-Wayne County Health Authority, DBA Authority Health.
All right. I had a couple of questions on this item. Can you, again, state your name?
Chair
and
Baker
title?
McCormick, this is Dr. Sheth, Division Director of Public Health and Medical Health Officer.
All right. Can you just talk about this, this item? Just,
Sure. So this is to execute our contract with Authority Health to serve as a management entity and provide the administrative and program management services under the federal grant that we were awarded through Health and Human Services Office of Minority Health. The federal grant award entitled Wayne County Catalyst for COVID Care, which is a 2-year grant award that will go through June 2023. That is focused on implementation of culturally and linguistically appropriate health literacy strategies to specifically improve uptake of COVID-19 vaccinations and prevention efforts in populations that are disproportionately impacted.
okay, and we had this, this contract come before us, I believe, last year for kind of the same management, administrative work. And I just wanted to clarify that there is still a need for this outreach since the numbers aren't nowhere near where they were. And you also talked about outreach that you already do in schools and community meetings and things of that nature. So can you talk to how these two are different, or item number 1 and 3 are different or not the same?
Sure. So this specific contract is to implement the grant goals that are specifically focused on health literacy strategies and implementing those culturally and linguistically appropriate health literacy strategies in efforts to improve vaccination uptake and COVID-19 access to mitigation strategies in populations that continue to have health disparities as it relates to COVID-19. And so our other funded efforts for COVID-19 through the state through MDHHS, serve, obviously entire Wayne County, and go towards our surveillance, monitoring, and access to testing and vaccinations throughout Wayne County. And this specific grant award was awarded under the Office of Minority Health, HHS Award, Advancing Health Literacy to Enhance Equitable Community Responses to COVID-19. And so we continue to see disparities in certain populations and vulnerable populations in terms of their uptake in vaccinations, and barriers and access to communication and information that really resonates with that community. And so this effort with Authority Health and the partners within the Authority Health contract represent community-based organizations that have strong ties to these populations and a strong history serving these populations. And so we hope to kind of implement these interventions in a way that we haven't been able to do.
Okay, I just wanted to get a clarification because it seemed like we're doing the same efforts, and I'm not sure as to what the difference is right now, especially since the numbers are declining. I believe the Director Melita Jordan also has her hand up to speak on this item.
Thank you very much. My name is Melita Jordan. I'm the Director for the Department of Health, Human and Veteran Services. And I just wanted to add a little bit to what Dr. Seth has already shared. As you know, when we receive a federal grant to do this type of work to address disparities as well as reach the population, the grant is 2 years, as she mentioned. And so we are in the second year, or going into the second year. And so there is never enough money to be able to address all of the ills and challenges and barriers, visible and invisible barriers that we face. And so therefore, this money really will be able to help and work with the community who serve individuals out there so that we really can be able to reach some of those still hard to reach areas. We do know that we still have, first of all, people that are impacted and also infected with COVID. We also know that we have people that are hospitalized for COVID. And we continue to have not nearly as many as we previously did, but we continue to have deaths from COVID. And so as long as we can provide access and services with using federal grant monies to help us to do that, it behooves public health to be able to continue to work in that area. Thank you.
Thank you. Thank you both. Any other questions from, I think Commissioner Anderson was, yeah, go ahead.
I just had see my mic's on. Quick question about when you say outreach, what types of outreach? Media? Different types of media, print, television, radio, whatever?
So our plan is multifaceted. So all of the things that you've mentioned. So we have communication partners and our community-based organizations that are really going to input into creating those tailored health messages that will hopefully resonate in this community. So that will include, all of the things you mentioned, traditional communications, but also some of that on the ground through community health workers, sharing those tailored evidence-based messages to those communities and doing some of that on the ground work as well.
Okay, will the media, whether it be printed, television or whatever, will it have the Wayne County seal that everyone recognizes as being the Wayne County seal?
So typically all of the communications that will come out will go through our approvals, and our communications team will also be involved too.
Is that going to be the Wayne County seal?
I believe so, yes, because it will be coming out through our communications efforts through this grant. And so we have lots of partners through this contract for this grant too that are supporting this effort. And so we will be making sure that it aligns with all of our communication standards at Wayne County as well.
Okay. I'm concerned that people realize it is Wayne County, not individuals, I understand if there's partners, other organizations that are contributing to the cause and helping to get this word out. But I just want to make sure that it's Wayne County that is identified.
Yes, absolutely.
Okay.
And maybe if you can provide us with some of the, information that they're disseminating, a copy of whatever, flyer, if you have that information, that would be helpful. And maybe we can even try to get some of that information out ourselves.
Yes, we'll be sure to share information created from this.
Thank you. Thank you. Vice Chair, Commissioner Colleen.
Thank you, Madam Chair. And I'm glad to have a discussion on this item with the Wayne County Health Authority, doing business as Authority Health. Authority Health is going to be an administrator of this grant. Am I using the correct term?
Yes, they're referred as a management entity in this.
Yeah. And I just wanted to provide a little history here for folks of Authority Health. I'm going to say I'm on the board over there and currently the chair. We were established in the early 2000s when it looked like Receiving Hospital was going to go belly up in Detroit, the hospital of last resort for the indigent. And we are a public body corporate created by the state, the city, and the county. And they all have representatives on the board. I've been the commission representative on that board for probably since 2007 or so. And our mission is to deal with on and underinsured, strengthening the safety net. Wayne County has the worst health records of any county in the state. And Detroit has numbers are even worse than the county numbers. We have all of these chronic conditions with our citizens. So we work right out in the community at street level where people need to be reached. I think people that need this kind of help and information are the hardest to find, are the hardest to reach. Our numbers are going back up a little bit, Madam Chair, with the COVID. So I just want people be a little more aware of the health authority health as we're doing business under and what we're doing out there. And we have very professional staff, and that's why we can handle being the administrator of this loan. But it goes to the core of what our health department wants to do and also what Authority Health wants to do. And that's to reach the most vulnerable people out there for good, solid health information. We have some community nurses. I see this provides some more community workers. So a lot of this work is going to be done on a one-on-one basis and right where people live and getting information into people's hands right where they live. So I just want to provide that. Thank you, Madam Chair.
Thank you. Are there any other questions? All right. Thank you very much. Is there a motion?
Move to approve this item, Madam Chair, item 3.
And moved and supported. All those in favor? Any opposed? Any abstentions? All right, motion passed. Next item.
Moving to the addenda, item 4, requesting Commissioner approval of Amendment 1 to a grant award with the U.S. Department of Health and Human Services, Health Resources and Services Administration.
Are there any questions on this item? All right, I'll take a motion. Been moved and supported. All those in favor? Any opposed? Any abstentions? Motion passed. Next item.
Item 5, requesting Commission approval of Amendment 5 to a 5-year contract with a 1-year option to renew with Assured Family Services, formerly known as Juvenile Assessment Center.
Are there any questions on this item? Discussion? All right. I'll take a motion on this item. And moved and supported. All those in favor?
Aye.
Any opposed? Any abstentions? Motion passed. Next item.
F, such other matters as may be properly submitted before the committee.
Are none. Next item.
Public comments.
There anyone in the audience that would like to make a comment? Anyone on Zoom or on the phone, Madam Clerk? And any emails?
There are no emails.
All right, we will move to the next item.
Adjournment.